thank you, and welcome to everybody who's here today. This class is Effective Health Communication and Health Literacy, Understanding the Connection. I'll be your instructor. My name is Nick Vera. I am the User Experience and Education Strategist for the network of the National Library of Medicine Region 2, working out of Charleston, South Carolina. So really happy to be with you all today. So I have a few housekeeping items to cover before we really dive into our content today. You can access the captions in Zoom by clicking on the CC button at the bottom of your Zoom screen. All attendees, as you probably already know, have been muted to cut down on that background noise, but we do welcome your questions and comments in the chat at any time. We will be keeping an eye on the chat. I have Sam Nunn with me here today as well from our National Training Office out of Utah. So she'll be monitoring the chat as well as me. But when you do make a chat, make sure it says everyone so that everyone can see your question, and more importantly, so that we can see your questions. And today we're going to save your questions and address them during the Q&A, which we have some breaks as well throughout today's presentation. So if we don't get to them right away, I promise there are some times where we will. We are recording today's session and we'll post it on our NNLM's YouTube channel in about 1 to 2 weeks. At that time, everyone who registered for the session will receive an email from us with the link for the recording. This class today is eligible for a few continuing education credits for the Medical Library Association. You'll be able to claim your CE through the evaluation link we share with you at the end of class. So it's 1 CE, I believe. This class also offers Certified Health Education Specialist, or CHES credit. So make sure you're taking advantage of that as well in the survey. And speaking of the evaluation, your feedback really matters to us and helps us improve future training. So please take a moment to complete it at the end. And for those that don't know, I want to briefly introduce the network of the National Library of Medicine, also known as NNLM. As the name suggests, the NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine, and we work regionally, getting to know communities on the ground and helping those communities serve the people they know best. But we also present across the entire country. We're also present across the entire country, and we work to advance the health and well-being of really everyone through access and understanding of how to use health information. And this includes both working with organizations like libraries of all types, schools, healthcare, and all sorts of community-based organizations. We do this primarily through 3 different methods. One, providing funding to organizations so that they can work within their own communities, other forms of outreach and engagement, and then like today, we offer a wide range of training and education opportunities. So I encourage you all to take advantage of all of what I just mentioned, as well as visit our nnlm.gov website to learn a little more. So we have a few things on deck for today. So this is our agenda, but really after the session, we're going to be able to define health literacy, describe universal precautions for health literacy, name 3 components of clear health communication, and identify 3 online resources and tools to promote health literacy. So let's take a look at that agenda again. We'll work with an introduction to health literacy, in which we'll cover what it is, why it's important, and the epidemiology of health literacy. So really, who is most impacted. Throughout this process, we will introduce you to tools which you can utilize to promote health literacy. And then we'll move on to communication, where we'll discuss the concept of universal precautions for health literacy and some best practices for communication. Then we'll look at how you can use Medline Plus, for example, as a tool for reducing disparities in health literacy. And finally, we'll discuss Ethnomed, which is an online tool you can use to reduce intercultural barriers to communication. So going back to that first part, what is health literacy? So let's start with a definition. So there are really 2 parts to health literacy: personal health literacy and organizational health literacy. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy, on the other hand, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So Helen Osborne, a health literacy expert, describes health literacy as a shared responsibility of patients and providers. So for the purpose of this class today, let's think about Osborne's definition as a shared responsibility between provider and receiver. So a provider can be anyone who provides information, and a receiver could be anyone who receives information. a patient or a library patron, or someone reading a public health message. So why is addressing health literacy important? Well, the simple answer is that low health literacy leads to poor health outcomes. So, for example, people with low health literacy are more likely to visit the ER and to have more hospital stays. One study showed that they are not only more likely to visit the ER, they are also more likely to return within 2 weeks. This makes sense because health literacy impacts one's ability to follow discharge instructions and follow treatment plans, and low health literacy can act as a barrier to effective disease self-management. This is especially true for chronic conditions that require complicated self-care regimens, and people with limited health literacy are more likely to skip needed tests and underuse preventative health care as well. One function health literacy impacts is the ability to take medicine correctly, which requires numerical skills to figure out dosage and reading skills to read directions. This is really widespread. So one systematic review on patient medication errors showed that between 19 and 59% of all medications are taken incorrectly. Not surprisingly, low health literacy correlates with a number of adverse health outcomes: worse reported health status, lower quality of life, and ultimately higher rates of mortality. So limited health literacy can really affect anyone. However, several factors are strongly associated with limited health literacy. For example, socioeconomic status, the epidemiology on health literacy shows that adults living below the poverty level have higher rates of limited health literacy than adults living above the poverty level. There are many socioeconomic variables that are associated with lower health literacy. Insurance status is just one example. So, disability is another factor associated with limited health literacy. In particular, hearing, speech, visual learning, mental, and emotional disabilities are all factors as well. Think about how these disabilities impact communication, and things that impact communication have the potential to impact health literacy. The National Adult Literacy Survey, also known as NALS, showed that more than half of the individuals with vision, speech, or learning disabilities performed at a level 1, which is the lowest level of health literacy, while 48% of individuals reporting a mental or emotional condition and 35% of individuals reporting a hearing difficulty also performed at the lowest level. Now, some disabilities are invisible, which is why communicating clearly and designing communication materials for accessibility are especially important. In the resource list, we've included links to resources that can help with accessible communication, including a tool for evaluating documents for accessibility and the best practices toolkit from the ADA for effective communication. Older age is another factor associated with limited health literacy. Among older adults, health literacy levels vary by educational level and access to financial resources. In fact, education mediates other risk factors in adults of all ages. Identifying as a racial or ethnic minority group and speaking English as a non-primary language are factors associated with limited health literacy as well. Some of the greatest disparities in health literacy occur among racial and ethnic minority groups. Cultural differences and language barriers impact communication and understanding as well. Belief systems and customs impact response to health information. Low education level is another factor associated with limited health literacy, but we want to keep in mind all these health literacy factors are really intersectional at many, many levels. So next, let's move on to communication. Effective communication is a building block for other parts of health literacy, of our health literacy definition that we talked about earlier. When health information is not successfully communicated by receiver or provider, it hinders the ability to understand, process, and use the information to make informed decisions about health. Poor communication can lead to negative health outcomes. If a provider has trouble communicating what actions a patient needs to take, what's the likelihood a patient will be able to follow through? If patient education materials don't effectively communicate information, how likely is the person reading the materials to be able to use that information to make an informed decision? And if the patient can't communicate symptoms or concerns to the provider, how can the provider make an accurate diagnosis or suggest an appropriate treatment plan? Health communication occurs both verbally and in writing. Print health information includes posters, web pages, home care instructions, discharge instructions, medication labels and instructions, education materials and treatment or testing options, warnings about air quality or storms, and other public health announcements. An essential part of our shared responsibility for health literacy is communicating clearly so that information is understood. So we cannot guess who has low health literacy. It's kind of a faceless thing. One of the hallmarks of health literacy best practices is applying universal precautions for health literacy to health communications. The idea behind universal precautions for health literacy is that we should communicate in a way that everyone can understand. To do this, we need to be as clear and precise as possible. We know that everyone is at risk for misunderstanding. According to some measures, only 10% of adults have the skills needed to use health information that is routinely available to us. Applying universal precautions benefits everyone. Research shows that interventions designed for people with limited health literacy also benefit those with stronger health literacy skills. When information is clear and it's easy to act on, people feel more involved in their health care and are more likely to follow through on their treatment plans or even enact new health behaviors. So, the Agency for Healthcare Research and Quality puts out a Health Literacy Universal Precautions Toolkit. This toolkit provides evidence based guidance for addressing health literacy. It includes 23 tools that you can use to improve written communication, oral communication, self management, and even supportive systems. This is a great resource for promoting organizational health literacy. So, if after this class you want to dive more into that, improving health literacy, that is, check out the link to the toolkit on that resource list that we posted. Our goal is to communicate as clearly as possible. So the left-hand column here shows that we can aspire what we can aspire to in order to have clear communication. You can also think of the left-hand column as the behavior change we need to implement in order to have clear communication. The right-hand column on the other side shows how communication usually works or what we want to avoid. First, to have clear communication, use plain language. To do this, choose common words that you would use to explain medical information to your friends or your family. Avoid medical terminology or jargon that may be hard to understand. So, for example, say stomach or belly instead of abdomen, skin infection instead of cellulitis, or eat less salt instead of reduce sodium intake. I get that one a lot. Use words that create images which people can visualize. For example, runny nose instead of excess mucus. Next, use simple messages and avoid complex ones. Keep your messages concise and to the point. Limit the information you provide to need to know information, not nice to know information. Sometimes educators feel compelled to explain more than the receiver needs to know because there's a lot of info on topic. Research shows that few people can remember more than 7 independent items at a time. For those with low health literacy skills, that limit may even be lower to 3 or 5 items. This means that this means that with need to know, your goal is 3 items and 5 at the very most. For clear communication, learn to anticipate misunderstanding and confirm understanding. Often we assume that a receiver understands our message simply because they don't speak up, and they might not. The English language infers that this silence means that a person understands. Conversation is like throwing a ball back and forth. We have to make sure that they catch the ball. Later, we'll go over the teach back strategy for confirming understanding. Clarifying when there's a misunderstanding. So this is important to recognize. Often that we try to create understanding by repeating the same thing only louder. Clarifying, on the other hand, entails using different language to clear up misunderstandings. So lastly, we want to use objective judgment-free language. So it's really easy to inadvertently shame someone when we talk about their health behaviors. An example is using the term non-compliant. Instead of saying, so I see here you've been non-compliant. You can say, okay, so I hear you say you haven't been taking your medication a full 30 minutes before you eat. That is objective and includes facts you learned directly from the patient. So there's no disagreement or feeling of judgment there. So many words that we don't think of as medical jargon might not be understood by everyone. Here are a few commonly misunderstood words. But cardiologists, pulmonologists, anti-inflammatory, PRN, benign, but really there's so much more we can add to this list. But who can tell me another word or set of words for the term cardiologist or any of the other terms here? Let me know in the chat. Heart doctor, yeah. That's what I was thinking too. Yeah, but you all get the idea. So really trying to keep it simple and kind of removing that barrier of lung doctor, that's a good one. Benign, not cancer. That one always throws me. Cool. Pro as needed, as needed. Love it. PRN if needed, PRN if needed. Yeah, you all get the idea. Cool. We'll go on to the next slide. So, sentences written in plain language are easy to understand. So, here are some examples of sentences revised for plain language. Your COVID-19 test results were negative could cause some confusion because isn't negative bad? The plain language revision of this sentence is you don't have COVID-19, which is ultimately what we want folks to hear. It's much more straightforward and easier to understand. The version of the second sentence, reduce sodium intake, could be confusing. Using plain language, it's simple to say, eat less salt instead. In the third example, take on an empty stomach. This one I think gets everyone at some point. The literal words are confusing. What does taking something on your stomach really mean? And empty of what? Food or drink? The plain language version is simply do not eat or drink before taking this medication, which again can be very hard. So, what are the plain language principles? So, in order to promote health literacy, we need to select, assess, and create print materials that are easy to understand. I'm guessing that some of you select and assess print materials, and others of you create print materials. Here are some plain language principles you can use in order to make that communication a little clearer. So, going back to what we talked about, use familiar terms, not jargon, acronyms, or medical terminology. We want to chunk the info. So chunking info means breaking documents into separate topics that are a little more palatable. Keep paragraphs short, use descriptive subheadings, use more headings and subheadings with less under each heading, and then use bullet points to organize important information. Organize logically. Put your most important information first and organize material in order of importance to that audience that you're trying to talk to. Start by stating your purpose at the and bottom line. Include background information towards the end. And then write in a conversational voice versus an academic or research voice. You really want to engage the reader. One way to do this is to use the active versus the passive voice. Active voice makes it clear who is supposed to do what action. It eliminates any ambiguity about responsibilities. Not it must be done, but you must do it. Not masks must be worn, but wear a mask. Digital.gov has a lot more comprehensive list of plain language principles that you all can look at. Using plain language is just a key component of our shared responsibility for health literacy. So if you want to learn more about plain language principles, I really encourage you all to take a look at that at digital.gov, and the link is on that resource list that we gave you. So there are two concepts that people sometimes confuse, plain language and readability. Readability is how easy something is to read. Readability is measured in terms of grade levels. The NIH recommends that a readability of a patient information material be no higher than a sixth grade level. There are readability calculators that you can utilize to see the grade level of a document, and these formulas are based primarily on sentence and word length. However, there are a number of issues with readability formulas. They aren't all created equal. So they aren't good for making an overall assessment of whether your document clearly communicates info or really is easy to understand, but it gives you a nice temperature gauge. First of all, online readability scores are inconsistent and often inaccurate. Secondly, readability formulas ignore most factors that contribute to ease of reading and comprehension. Just because someone can read something at a certain level doesn't mean that they can understand it or know what to do with it. If you rely on a grade level score, you can be misled into thinking that your materials are clear and effective when they may or may not be. That's because readability formulas don't really take into account the user's context or the principles of plain language. So by contrast, plain language addresses factors that contribute to ease of reading and comprehension, ensuring that readers can grasp the message the first time they read it. I love this cartoon. So the bottom line here is readability, plain language, and health literacy are all very important. So it is important to understand what makes each unique. So now we're going to kind of switch gears and I'm going to talk about a tool you can use to assess written materials for ease of comprehension. So before we really dive in, I'm going to pause for a moment. Sam, do you think I could have my screen back? Thank you, thank you. Lovely. So we're going to talk about the suitability assessment of materials, or SAM, not the SAM that I just talked to, but a different SAM. SAM, the suitability assessment of materials, is an instrument which offers a systematic method to objectively assess health information materials in a short period of time. SAM scores materials into 6 categories: content, literacy demand, graphics, layout, typography, learning stimulation and motivation, and cultural appropriateness. Within these categories, SAM lists different factors, and for each factor, SAM has a scoring guide. This takes the subjectivity and guesswork out of assessing written communication materials. Here are some of the factors that we can kind of see over here. So purpose is evident, content about behaviors, reading grade level, writing style, context is given, type of graphics, and you can rank them based on what follows underneath. Um, there's just different types of areas that you can look at. So, but before we really dive in, I think here are just a few of the SAM scoring criteria for subheading and chunking, which are really important in what we've kind of already talked about. So when you're thinking about your communication, are the groups listed under descriptive subheadings or chunks? Is it broken down so that somebody who's reading it can really digest what they're reading and kind of take away from it what they need, more importantly? So with this criteria in mind, we're going to share a link in the chat box right now to a printed document about pertussis. When you have a chance, click on that link and use the SAM criteria guide that you see here. And you can also use the link as well to see more. But we're going to grade it for chunking to give the pertussis document a score, or subheading and chunking. So really just looking at this area right here. And then we're going to take about 4 minutes while y'all do that, and we're going to come back and you all can tell me the score that you think it should give. And then that's going to be superior, adequate, or not suitable. We'll take about 4 minutes from you all to look at the document, kind of peruse it, and then you all can give me the answer and we'll explain why it got the score that it did. And feel free to put it in the chat when you know the answer if you'd like, or you can wait the 4 minutes. We'll give you all about another minute and we'll talk about it. Okay, cool. We can go ahead and come back to the answer now. You don't mind, Sam? There we go. Okay, so For those that did put superior in the chat, it did get a superior score, but let's talk about why. So on the left, you'll see that descriptive subheadings where we have a nice bold with the blue font of like what is pertussis, and then what are the symptoms of it with a brief description under each. And you can see how it's evenly spaced out and that it's kind of easy on the eyes, kind of easy to digest, and they break all of the heavy information on the left rather than spreading it all the way out. And then on the right, we can see that chunking really kind of come to life as we kind of start to get to towards the end of the document on more tips, ways to really kind of get involved and other things like that. But really the chunking is going to be really key here. Go to the next slide. Cool. But let's talk about visuals next. So visuals such as pictures, drawings, charts, graphs, and diagrams can be an effective way to convey information because they fill in where words may not be understood. So visuals shouldn't be used in place of text because people can interpret visuals just as they do words in different ways. However, visuals can enhance text and help reinforce written or oral instructions. And we're going to go over some tips for using visuals in health communications effectively. So for the first one, concentrate on the main message. Think about what action you want the person to take. Use images that provide visual cues. And then two, use clear headings, labels, and captions. These help you be clear about the purpose of the image. For instance, the image on the left shows a mother drinking and her baby inside her also drinking. And the caption says, when mother drinks alcohol, baby drinks alcohol. Alcohol crosses the placenta and circulates into the bloodstream of the fetus. The caption makes it clear what the visual is intended to convey here. So three, use simple, realistic pictures. Research shows that when illustrating a medical concept, simple line drawings are often most effective. And then four, use color to aid comprehension. So for example, in the Pacific Northwest this summer, there were warnings about air quality due to forest fires, which happen quite frequently. The numbers about PM 2.5 on their own don't really mean much without context. But the public health messaging about air quality was accompanied by green, yellow, orange, red, and purple markers. Those make it a lot easier to understand when it was safe to go outside or when to limit outdoor activity. And then five, keep in mind that there are variations in the interpretation of standard images. Sometimes these reflect differences in the symbolism that prevails in different cultures. For example, in some cultures, the image of an owl represents wisdom, and in others, it represents death. So let's move on to verbal communication. Here are some best practices for clear verbal communication. First, we want to listen carefully. Try not to interrupt people when they are talking. Pay attention and be responsive to the issues they raise and questions they ask. Use the receiver's words. Take note of what words a receiver uses to describe their health concerns and use those words in your own conversation or response. Use plain language, not medical language. You might notice some overlap in the list with the print communication. With the verbal communication, it's equally important to use plain language and avoid jargon. Next, we want to slow down. If you talk too slowly, it's harder for people to understand new concepts or formulate questions. Speaking slower increases comprehension for people who might have hearing loss or for whom English is not their primary language. So we really want to slow down when needed. And then limit and repeat content. Repetition can really help people remember information and give them more chances to ask questions. So for example, you'll notice we're repeating some of the same information in this webinar, such as use plain language, which is a key takeaway. Just like with print communication, keep things to a need to know basis and not a want to know. Remove extraneous information and limit the essential points to the essential points rather, but really just demonstrate how it's done. Instead of just telling people how about something, include a demonstration where you can, like for example, if you're showing how to cough into your elbow instead of your hand, show them, act it out. And finally, use graphics. Just like with print communication, visuals can fill in where language just may not be connecting well or understood. And then confirm understanding. So research shows that people with low health literacy are able to, yeah, so research shows that people with low health literacy ask fewer questions. When you say to someone, do you have any questions? It's easy for the receiver to answer no. This could be because they are embarrassed, shy, don't understand, or they don't realize that there are things that they need clarification on. Instead of saying do you have any questions, invite questions by asking what questions do you have? This normalizes asking questions and encourages the receiver to think about what they need clarification on. It's important to confirm understanding. However, when you ask, do you understand? It's very easy for someone just to say yes. I know I'm guilty of that. Instead, you can use the teachback method to confirm understanding. Who here is familiar with the teachback method? If you are, drop a note in the chat. Love it, Mary. All right. Yes, I teach it. I love it. Yeah, especially if you're working with students or patrons on a regular basis, or you're just very front facing wherever you work or the people you work with. Yeah, that always helps a lot, is especially with students in libraries or just anybody kind of coming into your space to work with you, right? But the teachback method is a method to ensure that health information is communicated so that the receiver understands it. You start by breaking down the information into small chunks. You teach the first chunk, then you ask the receiver to teach it back to you in their own words. If they understand, you move on to the next chunk of information and do the same thing over. If they don't understand any part of it, you reteach the information using different words. So when you use the teach back method, it helps to convey it's not a test of understanding on the part of the receiver. One way of doing this is to say, would you mind repeating back the instructions so that I can see if I was clear? The focus there is now on you, if I was clear. So we're going to break away here for another one, but we're going to go into Medline Plus now. So we're going to turn to that site and we're going to go through a few resources for you all as well. Let's go to move this over here. And we already have it open. Okay. So for those that don't know, Medline Plus is an online health information resource from the National Library of Medicine for patients, their families, and their friends. Medline Plus has reliable health information that is really easy to understand in both English and Spanish. And the best part is it's ad-free. So Medline Plus is a tool for promoting health literacy because the information is presented with the principles of plain language in mind. So we're going to do a quick tour of this and we're going to show really how well it is. So once you get to the main site, you'll see that everything's laid out very nicely, user-friendly. Colors are not overbearing, but also they break things down very easily for you into boxes. NNLM really is about their toolbars and their search boxes as well. But for this example, we're going to look up heart failure. And we're going to see what pops up. So we can see here that we have a brief kind of synopsis of what heart failure is, but really we want to learn more about it. So on this particular page, there is a lot of info on symptoms, diagnosis, treatment, and prevention. And one thing that's unique about Medline is that although it's written for consumers, at the bottom of each topic page are links to journal articles. So if we go down, well, actually, we don't even have to go down. We can just hit research, hit journal articles, and you can see for folks that maybe want to learn or go a little more in depth with what heart failure is, maybe read up on some research, they can always do that. And so that none of you are ever lost, what you can do to go right back up to the page instead of scrolling endlessly, you can just hit that little triangle and it takes you right back up to the top. But if you want to direct people to information that is authoritative and easy to understand, Medline Plus is a great resource. Also, these health topics summaries rather are in the public domain. So you can feel free to use them and distribute them as part of any health promotion or prevention campaign that you all might be thinking, we might need this. And to go back to the main page, we'll just click that. But one thing I also want to point out is that you can also go down to the bottom and you can see easy to read health information. So these are also really good to have. They have different areas that you can look at. So like what is acne, alcohol, different things that you can kind of play with and maybe use in your own day-to-day. And we'll go back. And then the best part about Medline that I think sometimes doesn't get enough credit is that it's offered in multiple languages. So for this example, there's a mirror version of this. that you can do. And if you just hit Espanol, it'll automatically show you that mirror just in Spanish. And you can find the link for that in the lower left corner of Medline Plus in the Spanish page. So if you're working with anybody who's non-English speaking or Spanish speaking or with lower levels of reading, you can easily kind of do that. And we don't want the browser to translate because it's already done for us. But it's a mirror image of what we would see on the other page. And when you're ready to go back, you can just go back. And if you go down to the bottom, last but not least, there's health information in multiple languages. So there's so much more to Medline Plus than meets the eye. So you can find various languages that you can find information on. Go back to the PowerPoint. Thanks, Leo. So reducing language barriers is very important, but to improve health literacy, you also need to address cultural barriers to health communication. And to do that, here are some tips. First, tailor messages to specific groups. Be aware of cultural norms and customs that inform communication, decision making, and health beliefs and behaviors. And then avoid those idioms and jargon that we talked about earlier. American idioms can be especially confusing for folks from different cultures or for whom English is not their first language. Next, we want to use high quality translators and interpreters when available. You want translators that translate the meaning of a message, not literally translate word for word each word. And then lastly, we want to avoid stereotypes every time. And there's a really good example of using some visuals in a communication. So here we can see, please protect one another from COVID-19. We see different folks all wearing a mask and from different backgrounds. But really, we can see here that the behavior here is just really wearing that mask and also washing your hands, but really thinking about what's the main message here, protecting each other from COVID-19. And you do that by wearing a mask, but also by washing your hands as well. So we can see if we're using visuals written communication, we want to really engage people and not alienate them. So if they're more likely to see themselves in that communication, they're more likely to kind of follow that suggestion, right? And we'll go and talk about Ethnomed. But before we really dive in, one resource you can use to improve cross-cultural communication and raise your awareness of different cultures is Ethnomed. Ethnomed contains medical and culturally relevant information about immigrant as well as refugee groups that maybe some of you work with. And we'll show that really quickly. Thanks, Tim. And we will go to Ethnomed. Okay. So here's Ethnomed. You can search this site really the same way you would Medline. By cultural group, clicking on the links on the top menu bar, we can show you different types of groups. So up here is really, again, we love our toolbars. Cultural language, we're just going to use Mexican as an example here. But what I love about Ethnomed is that it provides you a really nice profile and it breaks it up into really digestible information that you can just have in your back pocket for whatever community you're working with, or maybe a community that you just don't really know much about. So I really encourage all of you to play around with it. But here we can see the geography, the history and politics, different languages, as well as greetings and displays of respect, etiquette, and what I really like, the nutrition and food. I think this is probably the coolest part of Ethnomed. Food is a really great way to kind of bridge any just finding similarities among different folks, right? So we can kind of get a little bit of the cold foods, hot foods, the religion, traditional medical practices, which is probably going to be very imperative if you're working with groups and providing health information. It would help to kind of have a better understanding of what cultural underpinnings might be guiding their decision making and kind of aligning whatever suggestions you have with that. But there's so many different types of information in Ethnomed that I really encourage all of you to look at. And you can also come over here and look at the clinical topics as well, which is right next to the cultural and language. And we can come down and we can actually look at refugee health as well. And there's different resources on this, as well as a bulletin that is going to be really important It even shows you when it was last updated. So if you do work with these types of communities, I encourage you to go in and take a look, see what's going on, and how you can better tailor your own communication to do that. So the last one we'll show, I don't think we'll go back to the slide, Sam. I'll just show it on here. Indian Health Services is another really great resource. So if you work with Native American populations, the Indian Health Services has some really cool tools for you to promote health literacy. So similar to Ethnomed, it provides some nice insight, but really we're going to go to up here, that toolbar, because we love our toolbars. And we're going to go to patient education. So under for providers, we're going to hit patient education. And from here, it's going to show us some different materials that we can use to kind of help folks, whatever it is they're doing, with whatever it is that they need or, are interested in learning more about. But there's a really great health literacy guide as well as some white papers that you can take a look at if you're wanting to learn more about health literacy among Native American groups, and how you might be able to work closely with them or work better with them. And I'll stop sharing my screen. And so really that brings us to the end of our presentation. So to summarize and kind of recap what we've done, health literacy first is a very, as we understand now, a shared responsibility among all of us. And universal precautions for health literacy ensure that we communicate in ways that everyone can understand. Clear health communication best practices include using plain language, limiting to need to know information, confirming understanding, and being aware of cultural differences. And last but not least, we looked at a lot of free online resources you can use to promote health literacy, including that SAM sheet, Medline Plus, Ethnomed, Indian Health, and the AHPRA Universal Precautions Toolkit that we showed you all earlier. But right now we're going to go into the chat and we're going to look at some different resource or questions that some may have popped up. But does anybody have any questions?
Yeah, there were some that appeared in the Q&A. If you want, I could read them off to you.
Yeah, I know it's early in appreciation, but how do we work with limited English proficiency and health literacy? That intersection. That's a really great question. I think it truly depends on one, the resources and the bandwidth that you have in your area, right? So I wouldn't encourage anything that goes about above your means or outside of those means. I would really encourage you to kind of look at the resources we talked about today, but also recognizing that we cannot always be everything for everyone, but we can definitely try, right? And so these resources provide that effort for us to have in our back pocket and maybe pull out whenever we need. But definitely, that is a huge intersection that definitely would like to be more, I guess, in light, right? It can really be anybody. It's not always just Spanish speaking. We have a lot of refugee populations where I'm at here that really utilize the library, and sometimes they have a hard time navigating it, and it can be really hard for the staff to kind of work with that. But I think time, also effort, and also just the resources that you have available, um, it can really go either way on that. And then from Kate, are we able to have next contact at the end? I'd love to ask him. Yeah, of course, for sure, Kate.
There was also a comment I was able to get from the chat, and this was related to the plain language slides. So for you don't have COVID-19 versus you tested negative, how do you balance accuracy with accessibility? COVID tests show false negatives, especially within a window period. I work in HIV testing and prevention, and we're always careful to not say you don't have HIV if someone tests negative in the window period. And I'll add this back at the top of the chat too.
That would be great if you could. Yeah, no, I think that's a really good point. You know, obviously two very different tests, right? One is a lot more, well, both are manageable, but also one just is very completely different, right? And so I think like leaning into that difference, but also recognizing that if you do test negative, for HIV, it's really important to kind of, well, what does that mean, right? So taking that next step and going through that verbal communication with the patient is going to be really, really key. And using that those clear communication best practices that we talk about, and also the teach back method of really understanding what treatment plans might be available, but really understanding that it's a good thing, but also it can be very serious, right? And so kind of bringing that into the conversation is going to be very key than just saying like you don't have COVID-19, right? I think again, they're just two very different things. To say you don't have COVID-19 doesn't mean you can't get it tomorrow, right? Or that it just didn't show up on the test, or like you said, a false negative, or even a false positive. Those are all very serious things, but also addressing what those are going to be very imperative as well. I know for myself, it's really hard to sometimes understand as the patient because doctors talk so fast and you have very limited time with them. So really taking the time to understand what is being said and how it applies to you, and more importantly, what do you do after that meeting is going to be really key for the patient to be able to have those informed health decisions, but also kind of make a plan for themselves, right? And then I see Jennifer's question. Can you please address ensuring accessibility for people with disabilities? We can't forget this huge opportunity to engage this population. Absolutely. Anytime you can make your communications, whether verbal, written, visual, accessible, I highly encourage you to do that. So that might mean changing font sizes or changing colors, putting it in different languages, whatever the disability is. I think definitely coming down to that level or up to that level, wherever it may be, and acknowledging that, it's going to be really key to engaging folks with whatever disability they might have. But if we assume everybody has a disability, that's also really great because that means the communications are going to be able to reach a much wider audience. And so that means just taking those extra few steps to look at that SAM guide that we showed you, for example, going through every single one, making sure the information is digestible, accurate, reliable, and also that it's doing all of the things that it's supposed to be doing, not reaching or talking about something completely adjacent, right? And then Sid, great question from Jennifer, by the way. Even if COVID is less severe, it's more contagious and false negative rates are higher among COVID than HIV testing. So what I'm trying to get is avoiding this false sense of security. I don't have COVID, you can't spread it. That's presented when just saying you don't have X, Y, or Z, when that's not the whole story behind a negative test. Absolutely, which again goes back to the point of really unpacking that, right? So that's again like a conversation of having with the person who's asking the question, the receiver, and making sure and ensuring that they're in a place when they're ready to leave or ready to be discharged or get that next bit of information that they understand. So again, the responsibility is on both sides, one, to understand, but also to make sure that you've communicated everything that you need to in order to do that. And I think, it is simplistic to say like you don't have it, right? But really there's a lot more to it. And in this presentation, we don't really dive a whole lot into that, but also we recognize that there's a lot more context here and a lot more of situational awareness that needs to be like taken, right? And Jennifer, your point about alt text is really important here. I recently just did an article, and the alt text for the images is really important. And there's a lot of great resources on alt text as well. So if you are creating visual communications, definitely lean into that alt text. It's so simple to do, and try not to use AI. I know that's been a trend lately. It doesn't fully capture what it is that you're trying to do. So just make sure you take that extra step and just ask yourself, like, what am I trying to say in this image, right? And writing it into the alt text so that when somebody hovers over it or it's printed out, it shows exactly what it's happening. So definitely a great point for that. And I believe Sam, you got that survey thing. So we're going to go ahead and post that link. So make sure you take advantage of your CE credit for today. And if anybody has any questions, feel free to email me. And please fill out that evaluation link. The best way to help us and use us is to do that. Just use the resources that we have and keep us going.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.